Welcome to the Center for Hip and Knee Surgery. We're pleased that you've chosen our nationally recognized joint replacement program for your total hip replacement. At the center, we're committed to providing the highest quality patient care with the latest advancements in joint replacement technology, state-of-the-art surgery suites for decreased infection rates, and dedicated healthcare professionals specializing in the needs of orthopedic patients. This video will help you and your family prepare for your hip replacement surgery and recovery. The topics we'll cover include anatomy of the hip, the risks of surgery, how to prepare your home for after the surgery, what you can expect during your hospital stay, caring for yourself after you leave the hospital, and exercises to do before and after your surgery. We encourage you to watch this video with your family and support team to give them a better understanding about joint replacement surgery and what to expect. As you prepare for your surgery, it's important to remember that you're not alone. A team of dedicated, highly skilled healthcare professionals will be at your side throughout this entire process. Our goal is to help you regain independence, mobility, and to free you from pain. We've helped thousands of people who suffered with the effects of joint pain, primarily caused by arthritis, who are now embarking on new and exciting life journeys. The Center for Hip and Knee Surgery is dedicated to getting people back on their life journeys and back to the activities and people they love. This dedication is why we perform more than 1,400 total joint replacements each year. The Center for Hip and Knee Surgery has received a number of honors for quality and outstanding outcomes, including being rated #1 in Indiana for joint surgery by Healthgrades, the leading healthcare ratings company, rated 5-star for joint replacement, honored with the Healthgrades Joint Replacement Excellence Award, and nationally recognized as an orthopedic center of excellence. The Center for Hip and Knee Surgery was founded in 1986 by joint replacement pioneer Dr. Merrill A. Ritter and was the first facility in Indiana to specialize in joint replacement surgery. Our surgeons are all specialists in total joint replacement, board certified by the American Academy of Orthopedic Surgery, and are respected leaders in their professional organizations. In fact, they're nationally recognized leaders in their field, treating patients from all 92 Indiana counties, the Midwest, and even foreign countries. Merrill A. Ritter, orthopedic surgeon, retired. Dr. Ritter is the founder of the Center for Hip and Knee Surgery. For decades, he was a professor at both the Indiana University School of Medicine and the Louisiana State University School of Medicine. Dr. Ritter is a respected researcher, lecturer, and author with national and global acclaim. He's also president of the Indiana chapter of Operation Walk, a charitable organization dedicated to bringing mobility and relief from pain to the people of third world nations. E. Michael Keating, orthopedic surgeon. For years, Dr. Keating was an associate professor of orthopedic surgery at Louisiana State University Medical Center. With over 30 years of excellence, his specialty is total joint replacement. Dr. Keating is an active member of many highly regarded professional organizations, and his research of the hip and knee has been showcased in many respected medical and surgical journals.
The hip is a ball and socket joint, a major weight-bearing joint. In this animation, you can see that in the normal joint, there's a cushion of cartilage that acts as a slippery lining for the joint. There are a number of common reasons for needing a hip replacement.
For example, if you suffer from rheumatoid arthritis, you have a disease which causes inflammation and destruction of the soft tissues in and around your joint. Both your cartilage and the underlying bone can be destroyed. As you walk, bone rubs on the bone. The nerve endings become irritated, and you feel pain. As the disease continues to destroy your joint, the pain becomes worse and worse. If you have post-traumatic arthritis, you've suffered an injury in the past which has prevented your hip from moving normally, or which has overstressed your joint. The abnormal stress on your cartilage causes the cartilage to wear away, so that bone rubs on bone. The nerve endings become irritated, and you feel pain. As more cartilage is destroyed, the pain becomes worse and worse.
Hip replacement surgery is usually very successful. However, any joint replacement is a serious procedure, and the decision to have the operation should not be made lightly. For example, there's always a risk from surgery and anesthesia. You may also require a blood transfusion. Although unlikely, there are also unforeseen complications that may occur after your surgery, such as infection, pneumonia, blood clots, permanent weakness due to nerve damage, or temporary weakness due to muscle trauma. Your new hip could be stiff, and there's a small possibility that your operated leg will be either shorter or longer than your other leg. On rare occasions, the ball may actually come out of the socket of your new joint. This most often occurs during the first 2 months after your operation and can usually be fixed without additional surgery. Another concern is that one or more of your implants may loosen over time. There is also the extremely rare risk of a bone fracture. Further surgery may be required to fix these two problems. Finally, there's a slight chance that your hip pain won't be relieved, or that you may develop a different type of pain following your surgery. Just as you've prepared for surgery with your physician, you'll also need to prepare for when you return from your stay in the hospital. First, you'll need to decide who'll help you for the 2-week period following your surgery. Because this person will need to be with you all the time, we recommend a spouse, relative, or close friend. This person will help you prepare meals, bathe, dress, and bring you the things you need. Keep in mind that you'll need some assistance after those first 2 weeks, but your helper won't have to be with you all the time. If you don't have a family member available, please call the hospital's case management at area code 317-834-9524 for assistance. And rest assured that there are many other options available for post-surgery care based on your physical needs and insurance coverage. If you're going to return home after your surgery, there are a few things for you to do in preparation. You should definitely cook some meals ahead of time and put them in the freezer. This will allow you to rest more on days when you're tired during your recovery phase. Also, move frequently used kitchen items and utensils to waist height. You'll also need to pick up all those throw rugs, as they can catch in your walker and cause you to fall. Assure that there is a clear path without rugs, electrical cords, or other items that would prevent a clear path of movement with a walker in frequently used rooms. Next, prepare the bathroom. If you can have someone install a safety handrail next to the toilet, this will help you get up and down from the toilet. If you have a shower, purchase a shower chair to sit on. If you have a bathtub, purchase a tub chair and a hand device for the shower head. This will allow you to transfer over on the seat and safely take a shower. Your shampoo, soap, and towels should all be available to you without bending. For this surgery, you'll need a walker, reacher, and elevated toilet seat to assist you when you return home. These items are available at many pharmacies, but can be purchased at the hospital. Keep in mind that this equipment will not be included as part of your hospital bill because it comes from an outside company and may not be covered by your insurance. Now, let's think about what to pack. You'll need comfortable pants that are easy to pull up and down. Sweatpants or lightweight cotton pull-on pants are a good example of clothes that will be easy to wear during this time. Remember to pack your toiletries and a robe. Also be sure to pack a good pair of shoes with a low heel and a rubber sole. You'll have some pain after surgery, which the nurse will help you control, but you must participate in physical therapy. Therapy is the best way to avoid complications and get you back to the exciting destinations you have planned for your life journey. When it's time, you'll say goodbye and be taken to the surgery room. The surgery room is cold to help prevent infection. You'll also see a large square above your head around the surgery table. This is called a laminar flow hood, and it filters the air to prevent infection in your wound. We take extra precautions, such as this special filtration system, to provide you the best care possible. The anesthesiologist will give you some medicine, and you'll soon be sound asleep. When you wake up, you'll feel tired and groggy, which is perfectly normal. You'll be in the recovery room, also known as the Post-Anesthesia Care Unit, or PACU. Then, you'll be taken care of by a specially trained nurse who will monitor your heart rate, blood pressure, and other vital signs to assure that you're coming out of the anesthetic with no problems. If a problem should arise, the anesthesiologist is always readily available. As your anesthesia wears off, you'll notice that your hip is covered with thick, bulky dressing held in place with elastic bandages that wrap around your leg all the way to your toes. These bandages help control bleeding and swelling. You'll also be wearing a space boot on your operated leg to keep it in the proper position and prevent pressure sores on your heels. On your other leg, you'll be wearing special surgical hose designed to slightly compress your leg. You may have a tube coming from your hip to drain the wound. You'll also notice that a catheter tube has been placed in your bladder to drain urine. It will remain there for 1 to 2 days. Once you're fully awake and your nurse feels that your condition is stable, you'll be taken to your hospital room. There, a nurse will again assess you to make sure everything is okay. You'll be placed on a pulse oximeter machine, which measures your oxygen level for the next 18 hours. The nursing staff will continue to monitor you at regular intervals. The morning after your surgery, you'll start physical therapy. It won't be easy, but remember, movement is critical to help prevent complications. You should expect to feel some numbness, pain, and discomfort in your incision after your surgery. And because everyone tolerates pain differently, we have multiple methods to help control postoperative pain. The first is the patient-controlled anesthesia pump. This computerized machine allows you to give yourself medication directly through your IV line. So, when you feel pain, simply press the button on the pump for additional pain medicine. But don't worry, the device has a built-in safety feature that only dispenses pain relievers in safe amounts. The button should only be pressed by the patient. The second method for controlling pain is oral medication. After your surgery, the nurses will start your pain relievers as soon as they hear bowel sounds and your stomach is rumbling. It's important that you take the pain medication that has been prescribed for you. The nurses may also use ice. Ice keeps the swelling down and helps control pain. Because of this, you'll be instructed to use an ice pack on your incision for 15 to 20 minutes, several times a day during your hospital stay. Heat should never be used on your wound. Finally, keep in mind that your pain medication may have side effects. The two most common are nausea and itching. If you feel any other adverse effects, however, we'll provide you with something that will help. If you need pain medication at any time, please tell the staff. There will be medication ordered that can help you. And remember, it's better to control the pain when you first start to hurt than waiting until it's out of control. Blood clots are a concern, especially after surgery on bones. Due to the type of surgery, long surgery time, and the inability to walk independently after the procedure, the possibility of developing a blood clot does exist. That's why we take precautions to prevent blood clots from occurring. The first is to apply elastic hosiery that keeps a slight compression on your legs. You'll wake up after surgery with one on your good leg. The other leg will have hosiery applied with your first dressing change. That usually happens on the second day. This hosiery will be changed daily, and you'll have 2 pairs to take home with you. Another precaution that we take is to use an intermittent compression device. A sleeve is applied on each leg and attached to a machine that blows up the sleeves at regular intervals, which causes the veins in your legs to contract. This simulates walking and will prevent the pooling of blood in your legs, which reduces your risk of clots. The device is removed when you're up and walking. Pneumonia can also occur after surgery. To prevent this, we need for you to work with one of our respiratory therapists to do your breathing exercises. During this therapy, you'll take deep breaths and actually cough in order to keep your lungs oxygenated and therefore protected from pneumonia. Surgery takes a toll on our bodies. It's important to drink fluids after surgery to prevent dehydration. Drink as much as you can without getting nauseated. Your appetite will come back gradually, so start out slowly and advance as your body tolerates. Remember, your body needs food to heal. Constipation can be a problem. Anesthesia and pain medicine can slow down your intestinal tract. It's important to drink plenty of fluids, eat foods with fiber, and take the stool softener that the doctor has ordered for you while in the hospital. If you feel uncomfortable or have not had a bowel movement by discharge, please discuss this with your nurse for other solutions. Infection occurs less than 0.5% of the time in our patients. There are many factors that can increase your risk. We take every precaution at the hospital to decrease infection, with the most obvious being hand washing and sanitizing. Once your caregivers have determined that you're ready to be discharged from the hospital, you'll be moving into the next phase of your recovery as you return home. This part of the healing process is equally as important as your surgery and hospital stay. We'll now share all of the tools and information you'll need to help yourself achieve the highest level of function and pain relief possible with your new joint. Prior to your leaving the hospital, the nurse will review any specific instructions with you. The following are general instructions for care once you're discharged.
As you prepare for your upcoming hip replacement, it's important to understand the benefits of exercise. both before and after your surgery. Exercising before your surgery will help you build up your strength and maximize your range of motion once your hip is replaced. It'll also be easier to do the exercises because you'll already be familiar with them. Exercising after your surgery is nearly as important as the surgery itself when it comes to ensuring a good outcome. You must tell yourself that this is an active recovery period, not a passive one. That's because once you leave the hospital, there's much work to be done in order for the muscles and soft tissue around your new joint to properly heal. Why 5 times a day? The answer is simple. Every time you go through your exercise program, you'll gain mobility. Lie down with your knees straight. Slowly and deliberately move your feet up and down by bending at your ankles. Do this 10 times. This exercise stimulates circulation in your lower legs, helps prevent blood clots, and stretches out your calf muscles, which you use to straighten your knee. While still lying down, tighten your thigh muscles by pressing the back of your knees down into the bed. You may feel your kneecap draw upward. Hold this position for 5 seconds and then relax. Repeat this 10 times. This exercise stimulates the quadriceps, the large group of muscles in the front of your thigh that you depend on for standing and walking. Please remember to make these exercises part of your daily routine. Not only will it help make your hip replacement a success, it will also help you set the right course for the wonderful journey that you want your life to be.
We hope this video has helped prepare you for your upcoming hip replacement surgery. Now remember, do your exercises before and after surgery. Eat a well-balanced diet and stay active during your recovery period. You're about to embark on a wonderful journey and join thousands of people who have gone from crippling joint pain to the freedom of painless movement. Everyone here at the Center for Hip and Knee Surgery is excited to join you every step of the way on your journey of healing.